Hello, Dr. Danaev here from Steinway Family Dental Center. We get a lot of questions about mouth guard or night guards, and today we're going to answer some of the most common questions that we got so far. So the first question is, what is the mouth guard or night guard, and why would someone need it? Mouth guard or night guard would usually be given to somebody who either clenches or grinds his teeth. It's called bruxism, when we grind our teeth or we bite very hard on our teeth. And usually it happens when we're not aware of it. Sometimes there are people who awake and they still do that. And usually if they do it when they're awake, they would know about that. Most people, when they do it at night, they're not aware of it, unless a loved one would tell them that, yes, of course, you do clench your teeth or you grind your teeth, because they hear a noise. And if you're sleeping with somebody who has that, it's actually quite annoying. And usually the spouse will complain that this is what's going on. Or sometimes parents would complain of children that have this habit. And the night guard will protect the teeth. It will separate the upper and the lower teeth and will keep enough cushion in between the teeth so you don't destroy them and you don't damage the teeth or anything around them. The next question is, what is the most common types of mouth guard? Well, like I said, night guard is one of them. There's also a guard that's called reprogrammer. It basically helps somebody to stop biting in a certain way. So it will correct your bite. It will also protect your joint here. This way you're not crushing the meniscus, which is the cushion between the upper and the lower jaw, so you don't grind it through. The next question is, what is the mouth guard for grinding and how does it work? Well, you can imagine if you're grinding your teeth, you have to bite on it way too hard. And usually the joint here is the same joint like you have in your elbow, and your elbow usually you in the rest position when it is not bent completely and when it's not straight. So somewhere in the middle of it is your rest position. So when we're sleeping, the jaw drops a little bit, so the teeth are not really touching, but the lips could be barely touching, which is okay, or could be closed, right? But the teeth are not touching, they're separated. So there is a space, and that keeps your muscles in equilibrium and your joint is in equilibrium and nothing is stressed. However, if you're clenching or you're bruxing your teeth, you're putting them too close together and you're putting a lot of pressure on it, and the pressure is inadequate because you're not awake to stop it. Some patients complain in the morning that they feel like they were talking all night, or they have this jaw pain, or sometimes during the day they feel like really tired or feel like the muscles are getting bigger on them because of that. This is all symptoms of you bruxing your teeth. Now, also majority of people are not aware that they're doing it. The next question is, how can a mouth guard help with TMJ disorder? What you can imagine, right? So we're putting something in between your teeth, so the teeth cannot be touching each other. So that protects the enamel from being crushed. It also protects the joint here, because like you imagine if I put something here, now I can't really close all the way, therefore my muscles are not as tired because I'm not doing this to it. So the same thing here, right? If I cannot close all the way and too much because there's something stopping me from it, then the joint cannot be damaged. So that is the purpose of the night guard. What is the sleep apnea mouth guard and how does it help with breathing? The sleep apnea mouth guard, usually what it does, it just thrusts your lower jaw forward, and with that, the airway in the back getting open, so there's more air can pass through, and it's easier to breathe, right? Don't get me wrong, you are still the one who has to breathe. It's not going to force air down your throat like a CPAP machine would, but it would at least open the airways so even the laziest muscle can actually pull the air now because it's open, right? The next question is, how effective are snore mouth guard in reducing snoring? Well, somewhat effective, because you still have a palate. If the palate is too soft, then it's still going to be flopping when you sleep. In that sense, I would say it's not as effective as some other procedures that could be done. For example, laser treatment with Soleil that we have, that will shrink the palate, and then you can breathe easier, get more air into you, and not snore. What is the difference between the store-bought night guard and mouth guard and the custom-made by dental laboratory one, or by doctor, of course? The difference is one is more precise and it has specific things that protects you, and you know that it's done correctly and it's not damaging anything else. The one that you buy in the store, you do yourself, it is not as good. It's much cheaper, of course, because you avoid paying all the doctor, the laboratory technician, and all the materials that they use, and you just bought something in the drugstore and you're using that. It is very cheap. However, you are the one who have to do that, and you are not a dental technician. So it's best done by somebody who knows what they're doing. Next question, how does the dentist create a snore or mouth guard or night guard for a patient? Well, usually you either take impression of the teeth on the top and the bottom, two separate impressions, or you would do what we have here. We use a scanner for that. So it's a three-dimensional video scan. There's no radiation to it, it's just a 3D video. And we would scan the top, the bottom, and the way the teeth are closing. And that emails to the laboratory, and then they will recreate the models for it, and then they would create a night guard. They, of course, will check how the teeth are meeting, and they would create correct meeting points for both teeth, kind of like jigsaw puzzle, right? It has to fit. So that is the important part of it, which cannot be accomplished with just store-bought materials. Next question is, how do you properly clean a mouth guard? There are a few different things that you can get. Number one, and probably the best of it, you can buy a special bath with the vibrating device underneath it, and you put special liquid in that, and that's going to do that. That's one of the ways, probably the most expensive way, but that is one of the best ways. The second best would be get tablets that's called Effident tablets. You can buy it in any drugstore. The real purpose for it is getting it for denture cleaners, but you can also use it on that. You can also use just a brush, of course. You're going to need to buy a bigger brush than your toothbrush, and you can use regular soap. Just keep it clean. If you want to put a drop of Clorox in it, you can. This is all going to make your night guard a little bit more palatable to wear because it doesn't look as dirty. Next question is, how often does a night guard needs to be replaced? Well, it depends on how much abuse it's going to get with your grinding, right? So if you look at it and you see there's cracks in it, it's okay. But if you see that there's holes in it, too late. It's not going to protect your teeth anymore. It's not going to protect your joint. So you want another one. The next question is, can mouth guard or dental guard protect teeth during sports or when you're grinding your teeth at night? Well, that's the purpose of it, right? So it will protect when you're grinding your teeth, so it will protect your enamel, it will protect your teeth. Can it also be used in the sports? Well, there's a difference between the night guard and the mouth guard. The mouth guard is something like a sports guard, right? Like you can see something that the boxers will use when they're boxing, so they protect their teeth so they don't break them. The night guard is slightly different. It's not as bulky, not as big. It's much smaller, much more comfortable to have that on. And the purpose is different, of course. The next question is, are there risks or side effects of using the night guard? And the answer is not really. The only benefit from that you get is that it protects your teeth and protects your temporomandibular joint, which is the specific name for that joint, and it does not have any side effects. The next question is, when should somebody consider a sports guard for boxing or football games and so on? And I would say always. You want to protect your teeth at any given time. You can even get elbowed when you're playing basketball. So there's different sports games, but hockey for sure, right? Golfing, no, you don't really need a night guard for that, or mouth guard. Well, that's all the recent questions that we got on the subject. So as we're going to get some more of them, I'm going to answer them as well. But for now, if you have any further questions or your specific questions could be answered right here. So you can give us a call and schedule an appointment, and then we can talk face to face. So the telephone number here is 718-728-3314, or you can go online on alldentalneeds.com and request an appointment.